to go ahead because we like to reward people who come on time. And my name is Petra Silton. I'm with Thrive, the Alliance of Nonprofits for San Mateo County, and that shouldn't be news to any of you. I'd like to introduce Georgia Farouk and Kirsten Scheidek and Rebecca Townsend from our team, and Melissa and Helen and Megan from the county. We're going to be together for the next hour and a half. So the first couple minutes, we're going to do some announcements because we've got some fun announcements coming up. And then afterwards, we're going to have Dr. Curtis Chan give us some updates from San Mateo County Health. After that, we're going to have two special guests from some national organizations talking about social media and traditional media tips and tricks, because we know that pretty much everybody put in social media as some of their outreach, and it's not necessarily something that's kind of a core competency for all of us. So I think it would be great to have some opportunity both to get some tips and tricks and to ask some questions. Then after that, for the last half hour, we're going to break out into, sorry, that was surprising to see my face. We're going to break out into breakout rooms based on kind of subject area. We did combine a couple of the smaller ones, and then afterwards we'll have a report out. So we'll talk about how things are going, and then when we get back together, Dr. Chan is especially interested in finding out what the groups come up with, what the challenges and successes are. So with that, I'd like to go ahead and turn it over to Thrive Executive Director, Georgia Farouk, who's got a great announcement.
Hi, everyone. It's so nice to see you all here. I know it's rare that we get the entire group together, so happy to see all of you, and excited to participate in the breakout groups as well and get to know some of you a little bit more. So we have an exciting announcement. We're going to be partnering with Sequoia Healthcare District this coming month. So please mark your calendars. You'll be getting an email announcement for March 11th. We're going to be bringing the community together for a Thrive Community Forum in partnership with Sequoia Healthcare District, where we're going to be actually sharing the results of a needs assessment that was conducted by Sequoia Healthcare District through the Gardner Institute at Stanford, and it's on community impact from COVID-19, and also a little bit about impact around vaccine messaging. And we are also going to be helping nonprofits connect with the state toolkit for vaccine messaging, and also the county tools that have been developed. So many of you have already been part of the vaccine communications and equity working group, where you're getting access to, or you're helping develop some of these tools. And so our hope for this event is that we get more people there to figure out how to use these tools effectively in our communities, and also to hear some insights from the report that was conducted at Stanford. So that is happening March 11th from 2 to 4 p.m. So mark your calendars, and we'll be getting the word out to you all. And I just wanted to also say a quick thank you to the Thrive team. Petra Silton, who welcomed you all. I just wanted to say a special thank you to Petra and also the Thrive team for all your work on this, and also to the county for your partnership on this initiative. And with that, let's pass it to the county, and Melissa from the county is going to be providing some announcements from the county.
Hi, everyone. Thank you so much for jumping on this call this Monday. Just some quick announcements from me. We do have a lot of cloth masks in the office right now. So if you need some more masks to pass out during your outreach efforts, please contact me and I can set some aside for you, and you can do a no contact pickup from our office. Also, if you didn't see my post or Helen's post on Curio last week, I'm looking for some photos of folks wearing masks or doing workout in the community that I'm going to put into a Spanish PSA, and we're with the hopes of getting that on Univision on TV. So if you're interested, please send me your photos along with signing those release forms. We're going to try to do B-roll video and then just have photos of people from the community in that PSA. So that would be really great. I'm still looking for those. And also Helen uploaded directions on how to self-tape and be a COVID influencer last week. So if you can take a look at that, if you want to pass that to some trusted messengers in your community or record those videos yourself, that would be wonderful. We'd really like to make sure that we push out those videos on social media, and we can also run those as ads online as well. So please let me know if you have any questions, let Helen and I know. And yeah, I just want to kick it off, make sure that Dr. Chan's on the call, but I want to introduce Dr. Curtis Chan. He's our San Mateo County Deputy Health Officer. I know many of you already know who he is. He's been on these calls a couple times, so I'm excited for him to join us again. So thank you, Dr. Chan. And I'll pass it over to him.
It's nice to see everybody. I'm having some difficulties uploading my PowerPoint. Can we transition to the social media presenter first? Is that person on?
I think they're not on till 1:30.
Okay. I'm sure I can figure it out as well too. Okay.
Otherwise, you can email it to one of us and we could work on it. Put it up.
No, I can figure it out. Just think of this as a long hello. It's good to see folks again. Okay, can you see it now?
Yes.
Okay, cool. All righty. It's like for some reason, slideshow from beginning. Oh, here we go. Set my clock, make sure I don't 1:10, make sure I spend 15 minutes. So nice to see many of you again. And I think I just want to spend 15 minutes describing this update of this little window that we're in. It's really exciting and important times because it looks like we're over this big hump of the surge. People are getting vaccinated. At the same time, you're hearing about the variants. And so basically there's this window that we need to protect the populations we care about, including older adults and adults with underlying medical conditions. So this is that window that we're in. And to summarize, I think what's really would be helpful from community leaders like you all is to really help us deploy a harm reduction approach for social gatherings and masks and wearing masks. So it's not just an absolute order or absolute recommendations to do it. And also, if any community member is concerned about any infection coming into their household, particularly because some of the younger adults and even children are back in school, back playing sports, or many restaurants are reopening, how do they quickly access testing and immediately begin masking, isolating, and separating themselves in the household? Because that's the major way in which older adults are being infected. So, I think for the next 13 minutes of my talking with you, and then I'm going to be listening to you in the small groups, is really how to empower all of you for the next 2 months and beyond. Because we really need to strengthen our community prevention approach and our response, particularly in these next 2 to 3 months until older adults are all immunized and a vast majority of adults with chronic disease have received vaccination as well too. And the specific objectives is to continually discuss the scientific rationale of the policies. So you as community leaders have 1 more or 2 more layers of information and context to provide these community recommendations to your communities. I'm going to summarize some of the frequently asked questions that people ask of us in the health department. And I think a big thing is that, again, for these next few months and beyond, we really need to be working in partnership closer together. I think before we chatted in December and January, I think a couple of you asked for my email and have actually emailed me. And I think at that point, I was cautioned because I'm new coming back to San Mateo County after being in San Francisco, that I just didn't have capacity to answer everybody's email, which I still don't. But I did include my email on the cover page this time. And if there's ways in which I myself or San Mateo County Public Health could be working in partnership with your organizations to develop a project, and particularly if we can coordinate with OCA and Thrive, that would be great. I realize that all you have scopes of work already from the funding, but also that many of you are leaders from your community-based organizations that receive different types of funding streams. And I don't think I introduced myself like the previous two times. So I think most of the folks in San Francisco know me, or many people know me from my heavy involvement with community-based organizations. And I've served on boards of directors for multiple nonprofits, including, for example, the Boys and Girls Clubs of San Francisco for more than 15 years and Komen Advocates for more than 15 years. So in many cases, I actually understand community-based organizations much better than I understand San Mateo County government. So I think that's my invitation to be working in partnership with you, because we really need to save lives these next 2 to 3 months. So why is there this window, and what does this window look like? So we're no longer in purple, or soon it may be announced that we'll be going to red, which would no longer be widespread transmission. It will be still substantial transmission still, so transmission rates still higher than before Halloween. So that's worrisome, and it's also worrisome because there's an increasing prevalence of these variants that are more transmissible. And vaccination, as you all know, and you're all participating in the vaccine equity meetings on Thursdays, is that it's coming along, but still relatively slow. Maybe 60% of those over 65 have been vaccinated. We haven't really started vaccinating adults who, for example, between 50 and 64 with complex medical conditions. We haven't immunized people with disabilities. So that's really my concern. And many places are reopening. You heard on Friday we're reopening, the state of California is reopening basically all sports. So, and more schools are being reopened. So all sports will be allowed by starting on Friday. And restaurants will likely be open very soon as well too throughout the Bay Area. I mean, indoor dining in restaurants. So with this window, there's kind of three kind of concepts. Is that who must we protect in the next few months? I already mentioned older adults, those with underlying medical conditions, who I think really need to be immunized quickly, but we might not have enough supply until, let's say, June or July to get them all vaccinated. I think there's a key role that you all have as the county and state government is just trying to figure out supply of particularly distribution and prioritization to the different vaccine entities like Walgreens and CVS and Blue Shield and Kaiser. Figuring out supply is something already complex enough. One big thing that you're all key people for is to increase or inform demand, particularly from those communities that have a good reason to distrust government. So those communities facing oppression, obstacles, racism, immigration concerns, stigma, less education. I don't think there is a huge, fantastic federal state approach to ensure that they have the right information. So, so this is a matter about supply and demand. So I think you're all extremely pivotal in key roles to ensure that those people have the right information. And the rest of the remaining slides that Helen and Melissa asked me to focus on is, some of the new information to limit transmission in these next 2 to 4 months. And I think, again, it needs to be a lot more nuancy than just a blanket, 6 feet away or no gatherings. So I'm really going to be asking you all, and we can work on this together. How do you actually explain and encourage to different community groups to limit the size of the gatherings, number of different groups they interact with, and the location to be outside or well-ventilated areas. It's not enough to just say wear a mask now or to give somebody a mask. It's, you saw Dr. Fauci describe this at length about wearing a double mask, and there's new CDC guidance about wearing a double mask. But when do you actually wear that double mask? When do you tighten that mask? How do you choose the right mask? And how do you communicate that? I think I don't foresee that happening at this great level, federally, state, and locally. So whatever you can do as a community-based organization that can and you can disseminate it more broadly throughout the region and state, we would love to be able to support you to do that. And again, the most important thing in my mind is that there's so many multi-generational households in which either there's students or young adult workers who are living with adults who are between the ages of, in their 50s and up to 64, living in the same household. It's so key and critical that as soon as somebody develops symptoms, that everybody in the household needs to get tested immediately. That really is going to be the key for us to minimize hospitalizations. And, when I first met many of you in early December, I think this was the number that I was describing. We did pretty well. We had limited in the first 10 months to 170 deaths. And I think for some of the calls, depending upon the group, I actually highlighted, look, we have 6 deaths amongst African Americans, 40 deaths amongst Latinos, 4 deaths amongst Pacific Islanders. Each one is important. And our goal was to, by February, let's see if we could not double this in 2 months. I mean, it seems ridiculous, but that was our concern, that we invested all this time and energy and we restricted ourselves for 10 months. In 2 months, we could worsen this. We've done actually better than many counties in the state, and the main strategies are really actually through you all as community leaders. And this is where we are now. You could see tripling amongst Asians. For Blacks, like I said, it was, here it is. So you could see when we went from 6, we quadrupled the amount of deaths for African Americans. For Latinos, we've almost tripled it. And for Pacific Islanders, we've tripled it. And I think many of you, and it's increased for everybody too, as well as Asians and whites. And I think many of you do know people who've been hospitalized and do know people who've died. And I think we're hopefully not going to have as big of a surge even with some of these variants. So I don't expect a tripling or quadrupling of deaths in the next 2 months. But I think, as you all know, every death matters. And the more we can prevent deaths, I mean, you guys are the actual people in the communities who, this is not a complex medical treatment disease. This is something about just actually wearing masks at the right time and avoiding large gatherings at the right time and getting tested at the right time. So it's you all as trusted leaders. And one thing that we learned about, so I think previously, I think in February, I put up this slide about COVID-19 variants. So it's definitely confirmed that these variants spread more easily and quickly. But what's been removed is that back on the 15th, at that time, the CDC said there was no evidence that these variants cause more severe illness or increased risk of death. Because so the counterpoint to that is that there is increasing evidence that we might be concerned about these variants causing more illness and more deaths, as well as how susceptible they are to the vaccine. So something that's changed, and you saw, I think, Dr. Fauci give a little preview of the CDC science reports about the benefits of things like double masking, and which are confusing and actually complex to do. There's only so much, I think, that the county, we as County Public Health and the Joint Information Center we can provide some basic information, but again, we really appreciate all of you as community leaders can really parse out and really develop the messages, the right type of messages in the right ways to your specific community members. So feel free to contact me anytime if you like some extra help or some perspective or understanding the data about this. So this is now on the CDC website about basically tightening the mask so it fits snugly to your face, and picking a mask with multiple layers to keep respiratory droplets out. And you can see in choosing the right type of mask too. So one, it's complex information. So I only have 15 minutes. I don't want to spend all my time on this. But finding the right type of masks, it does include things like the KN95 masks, which the Asian community in Asia has been using, as well as the Asian community in North America has been using. And many people hypothesize that these tighter masks are the reasons why there's less transmission in those Asian countries. Previously, I think we had messages as a government not to utilize these masks because we wanted to save tighter masks for healthcare providers, but there should be a high enough supply now. So those are now on the official CDC websites. And the right time to wear them would be not just when I would say don't wear them when you're just like there's nobody around you within 20, 30 feet, but it's a good time to be wearing them if you're in a crowded indoor environment. So last time, we went through this, we discussed the emerging CDC evidence about how to protect yourself and your home, your household members from COVID-19. And right after I did my series of presentations at the end of January, I think, it was just so nauseating just talking about what I was seeing from the data, the number of household transmissions that was happening in particularly Latinx households, Filipino households, and some Asian households where people living in multi-generations living in a single house or a 2-bedroom apartment. There's this great article from the LA Times. I think I sent it, I think some of you sent it out. And this really describes basically in a narrative, just some of the things that we're seeing from our contact tracers are seeing. Again, it's the 20-something-year-old young adult who needs to continue to work on the front lines of a warehouse or workers somewhere, and they're bringing it home and they're infecting their parents or uncles and aunties. So there's huge social and racial implications for this. And that's the relevancy for these visuals that the County Office of Community Affairs has developed with many of you, is to immediately mask, isolate, quarantine, and test as soon as somebody develops symptoms. If we don't do that, we're basically going to be infecting those people who haven't been vaccinated yet. So, and I think I conveyed this last time, and just in the interest of time, I'm just going to fly through that. These are some of the visuals that we discussed previously. I think for this, for example, insulating your household support bubble. Now it's going to be, social bubbles are now going to be allowed now, or social gatherings are going to be allowed. I think we still need to communicate to your community members why it's not a good idea to have like large gatherings and multiple large gatherings. And if one person has 2 or 3 social gatherings within 5 days, and each one involves 12 people, that person can be infecting up to 36 people or 36 different households. So, and a big key message is now, particularly with tighter masks like the KN95 masks or double masks, it's not probably effective to recommend that everybody wear double masks all the time, particularly as the weather gets warmer and hotter. So how do we work with you all and to develop those messages that resonate with your community members? If several CBOs could be developing these messages together and several logos can be developed that fit for various populations, we should try to put multiple logos on there and utilize the same message. So I haven't seen anybody communicate this very well yet. Like I said, the CDC just about put those recommendations on, but they really need to be, these messages really need to be communicated to our community. So I think I'm gonna stop there, and I'm gonna be listening to the rest of, I'm gonna join a couple of breakout groups, I'm happy also to take questions as well too. And I have my email address as well. So thanks so much for allowing me to chat with you, and I look forward to further dialogue with you in the future.
Curtis, we have one question that came in on the chat that I'd like to address if you could,
Sure.
which is about the priorities. And the question was about essential workers as when the essential workers come in, but also just helping everybody on the call works at a nonprofit. How do they know when the nonprofit staff is up for vaccines?
Yeah, I think that's a great question. And I know, and I heard some of that being discussed on Thursday's vaccine equity call. So I'm just I think it's probably not going to be helpful if I know Louise gave a good message towards the end of the call on Thursday. So, and I think it's an ongoing discussion at the state level and state policy when social services are in line. I think, for example, like for the last question on Thursday, if, for example, you're a social service provider that provides healthcare related services, you could be vaccinated as 1A. So for example, the question that the Reverend had, if they're providing kind of health related services during when somebody is, sick or passing, I think one interpretation could be they could consider themselves a health service worker. For agricultural workers, like the next sector is agricultural workers, if you're a community-based organization, my interpretation is if you're a community-based organization that works directly with, like, interacts regularly in a direct way, not primarily on Zoom, not working from home, but working directly with workers on the field, you're part of the agriculture sector. So that's my interpretation of it.
Great, thank you.
Yep.
And thank you for staying with us for the rest as well. We'll look forward to sharing out at the end of our breakout sessions what we come up with. So thank you. We'll move on to the next portion of our meeting today. And I want to say a special thank you to our two next guests because they're doing this, they're donating their time to talk about social media. And they are not content experts in COVID, that is what Dr. Chan is, but they're experts in social media and traditional media as well. So Grace Deal is a Senior Associate of Communications and Membership with the Leadership Now Project, a national membership organization of business and thought leaders focused on renewing American democracy. She focuses on communications for the organization, both internally and externally, as well as driving member engagement through events. Grace holds a Bachelor's of Arts in Public Policy and Leadership from the University of Virginia. Our second guest is Isabel Jate. She's Vice President of Growth and Operations for McPherson Strategies, a communications consultancy that develops, amplifies, and communicates social responsibility and philanthropic initiatives. She's a cause-conscious marketing and communications strategist with over 10 years of nonprofit and marketing agency experience with an MBA from the University of Chicago. So with that, I'd like to introduce Grace. And I think Grace is going to start, and then Isabel.
Welcome, everyone. It's a pleasure meeting you all.
It's so great to be with you here today. I'm Grace, and Isabel is the woman who just spoke. And thank you so much for having us. We're excited to be here to chat with you about social media and earned media. So I think before we get started, we have a quick poll we're going to run, Petra.
Yes. So we were all curious what everyone is using for their social media. So Kirsten's going to put up the poll for you, and you can pick as many of these as you want. So let us know what you guys are using for social media.
Yes, I'm very interested.
We'll hit all of them. There we go. I thought somebody would be on WhatsApp.
Perfect. I get to talk about that one then.
Okay, almost everybody on Facebook.
Very interesting. Good to know. So is everyone in this group in the San Mateo area?
Yes.
Wonderful. And feel free to like introduce yourself in the chat. Curious to see what everyone is working on, all the amazing work that your organizations are doing. Great. Okay, so it looks like Facebook, Twitter, and Instagram are the most popular, which is unsurprising, but always good to know. So great. All right, so I will go ahead and launch into this. You can go to the third slide there, Petra. And just really quickly, just for context, Petra did a lovely job of introducing me, but again, I'm Grace Steele. I'm based in the Washington, DC area, and I am a senior communications associate at the Leadership Now Project, which is a membership organization. We're national, but we have chapters across the country, and we are really focused on improving American democracy. So our audience is mostly made up of business leaders, which has really kind of informed how we've developed our social media strategy. But I'm really excited to talk to you all today because 18 months ago, I was starting at Leadership Now, and we had no dedicated social media resources. I was the only team member who was working on it. And really, I kind of had to do a little bit of self-instruction, my own research. So I'm just hoping to be helpful in kind of telling you what I wish I had known, 18 months ago when I was starting out, and essentially how to develop this in a way that is both good for limited resources and limited time, which is what I was working with as well. So you can just start with the basics here, just to get us all on the same page. What is social media? Social media is really just a tool to connect you to your audience and communicate your message. So those are the two really important components of what we'll be talking about today. And ultimately what you're doing is just building an online community. And you all have done such incredible work building your community locally and on the ground. So, this is just a form of that online, which is especially useful during COVID times. So we can go to the next slide. The first component is your audience. You want to make sure that you're reaching the right people. Otherwise, your message is going to fall on some deaf ears and might dampen the impact of your work. So some questions to consider: who do you want to reach and why do you want to reach them? What do they care about and what channels and platforms do they use? And also important is what platforms do they trust? Because trust is a really important part of this as well. So there are kind of two ways that we use to figure out our audience, what they were on, where they were, and what they cared about. We did some sample polling of our own membership to kind of try and gauge what tools people were already using and where we could plug in with our strategy. And the other thing that I did was just some demographic research. There's so much research out there about what groups of people are using what tools. So that's really powerful as well to help you determine where your audience is. Go to the next slide. Great. The second component is your message. So once you kind of have that captive audience, what do you want to be telling them? You want to make sure that you have a really clear picture of what you're telling them. So really you're telling a story about your organization, the work you're doing, and the impact you're having. And some things to consider is, how do you want to be perceived? And what do you want your audience to walk away knowing and feeling? And really, your message should be tied to the goals of your organization as a whole. What are you trying to accomplish? And your value proposition as well. What are you bringing to the table? What services are you providing? And that is really going to influence. That's really going to influence your message. So I think it's great to kind of start from base one and develop some really clear messaging guidance to standardize this across your platforms and your team, so you can make sure you're really telling a clear story. Go to the next slide. Great. So these are just a couple ways that I've found success with increasing social media engagement at Leadership Now on almost no budget. First is really thinking about planning ahead. The first recommendation I have is to build a content calendar, which is exactly what it sounds like. It's just a scheduled list of content for your different channels. And really what that helps you do is plan ahead and have kind of a, make sure you're hitting the key themes that you want to hit. So the way that you can kind of construct that is say, okay, in our organization, what are the key holidays, milestones, fundraisers, any kind of key markers that you have. And then you can work backwards and fill in content from there to make sure that you're kind of hitting those key points for your organization. And we've used them on a monthly basis, on a weekly basis. Around the election, we had content calendars with like scheduled posts for every single channel every day because we had a really clear message we were communicating. So I think that planning ahead also saves you that time later on. To make sure that you have this clear message and you're thinking about everything ahead of time. There are some tools that you can do this for free with. Content Cal is a great one for scheduling posts. You can also use Hootsuite. It's really great. Those are free tools. And yeah, I think that planning ahead is a really important part of kind of developing out your strategy and also taking some of the stress off your future self. So we can go to the next slide. All right. The second is to set realistic goals for yourself and for your organization. That way you can kind of check in on your progress. And I will speak a little bit more to how to check in on what progress means in a couple of slides. But you can create these sort of short-term goals specific maybe to a project or a deadline that you're working on. So maybe that's on one specific platform you're interested in engaging and creating more engagement with a specific post that's leading up to a specific event. But you also want those longer term, wider goals that align with the mission of your organization. So if you find out that your audience is really only using Facebook, then align some of your longer term goals with how to increase your engagement on Facebook and how to really build a community there. So we can go to the next slide. Great. This was something that I found was really, really helpful. I'm sure that all of your organizations doing such great work have pre-existing content that you've been working on. So within your content calendar, you can kind of backfill using what you already have. So you're not starting out with a blank slate, and you're also not reinventing the wheel with your limited time and limited resources. So you can pull in quotes from previous conversations, images that you've taken at past events, or videos as well, press releases that you've done about important moments in your organization, reports, information, data that you've collected, any of that, really kind of build that into your content to start kind of curating that feed of interesting content so that when you approach your target audience with your page, it's not a blank slate for them to look at. They already know who you are and what you're about and the work that you're doing. So for us, that was pulling in a lot of the analysis that we already had, some of the graphs, and I will talk in a second just about how important it is to use images and video. But it's really great to kind of pull in all that content you already have, so you don't you're not putting too much strain on your limited time. And images and video have been known to increase engagement by as much as 37%. So those are really great tools to engage with your audience, and use them as frequently as you can would be my suggestion. Same with infographics, if that's something that your organization has. You can use Canva to create those for free, really beautiful kind of plug and play sort of templates for those graphics. Really easy and can really improve the engagement with your posts. So you can go to the next slide. This one may be actually, sorry, one more back. Thanks. This one may be the most important of all, actually, is find out who your key partners are that you're already working with in your daily life. Who are you working with? Who's aligned on your mission? And kind of pull them into this strategy as well. This is a really kind of useful way to expand your audience. We find that using trusted figures within the community of your audiences that you're already trying to reach, engaging with your message or enhancing it, one, creates buy-in from your target audience, and also expands the amount of people that are going to be seeing your message. So it's going to increase your exposure with that audience, which is great. That can be a local elected official, it can be a celebrity, it can be a local leader, it can be one of your team members who's particularly passionate. And so we call them amplifiers, and we basically send them materials in advance and say, hey, can you post this? And it's just an easy copy and paste. And a way to do this organically is just to tag organizations that you're working with on a project, tag these leaders, and then you increase the chances that they're going to repost your content and expand the audience that it's reaching. And finally, go to the next slide. Yep. Is to track your progress to understand what's working and what is not. I would just say that success is going to look different for every organization. So make sure that you're looking at your analytics, learn how to kind of evaluate them, and familiarize yourself with which key metrics that you're really trying to evaluate, which platforms are most important. And I would say that there's kind of a lot of lingo out there on like impressions, engagement, and clicks. So just you can familiarize yourself with which ones you think are most important, aligned with your goals. So now I'm just going to quickly talk about some of the tips and tricks for each platform. I'm not going to go through each bullet. I'm happy to share this presentation too afterwards. And this is not a comprehensive list. Social media is, hundreds of different things, but these are some of the ones that I think align with both what you're already using and then what we use as well. So the first is Twitter, which is a really powerful tool to be involved in kind of the dialogue that's happening in your community or in the world at large. We find that it's best to kind of aim for a couple of posts a day, 2 to 3, to try and kind of build up your feed and your content in the morning if possible, when people are engaging with their phones. And the tip I will highlight here is the list feature on Twitter is really helpful. Lists help you pre-build accounts based on a topic. So it makes it a lot easier to kind of sift through content in the morning and see what your partners or interested parties are working on without kind of doom scrolling through Twitter. So we can go to the next slide, which is on Facebook. And I think all of you said that you were using Facebook, which is great. We actually don't use it at Leadership Now, but I'm familiar with how to use it. So Facebook is really great for kind of creating that community, creating that group around your mission. So I think the thing I'm going to highlight on this slide, just for the sake of time, is make sure to set your page up as a nonprofit page, because you get some special features, which include making donate the main call to action on your profile page, and also your Facebook supporters can host fundraisers for you. The next one is Instagram, which a lot of you said you're using as well. Instagram is something I've been building out. We really saw how powerful it can be over the summer with the Black Lives Matter movement. It was an incredible tool to inspire action. So it's a really great place to communicate the story and the value of your organization, what you're working on. And overusing tagging on Instagram is actually, it's really important, because the feed is based on interaction. So the more people you tag, the more likely it is to end up on somebody's feed. So we can go to the next one, which is WhatsApp, which I'm glad that somebody said they're using. We use it every day to create individual community channels. We do it on the local level or the chapter level, but it's a really great way to collect input, share information or events. And I'll say that the tip on this one is to, if you have a WhatsApp group, make sure you have a conversation starter in that group who kind of is accountable for creating conversations and keeping them going, and kind of keeping a flowing dialogue as you're trying to kind of start that group up. Go to the next one. Finally, LinkedIn, which I don't know how many people said they were using LinkedIn. I didn't get a chance to look at that. It's our #1 platform because of our audience. LinkedIn is a very specific tool. It's really great for professional connections, sourcing new talent, and sharing relevant information on some talent requests or information about your what your organization is currently working on. But the one thing I will note is that LinkedIn is not chronological, so make sure that anything you're posting there is kind of an evergreen piece of content, because it does not work well with timeliness. Okay, so I will turn it over to Isabel really quickly to talk about her perspective on earned media opportunities.
Great. Hello, everyone. And thank you again, Petra and Grace, for allowing me to join you today to talk about earned media. As Petra said, my name is Isabelle Jeté. I work as the Vice President at McPherson Strategies, and we're a firm, a communications firm that specializes in working with clients that are operating at the intersection of brands and social goods. So we do have nonprofit clients. Leadership Now is actually one of our clients. We work with also for-profit corporate social responsibility departments, for instance, in the private sector, or social entrepreneurs, et cetera, but all through the lens of trying to make our world a better place. So this is, I recognize we don't have a whole ton of time, and obviously this is something that we could go into quite extensively. So we'll just provide you with a really brief primer today. And, you know, I welcome you to reach out to me. We'll make sure that you have my information if you have any follow-up questions after today. But the first thing to consider is with public relations, the reason why, as a nonprofit, you would want to engage in getting media coverage is for a number of different reasons, but certainly it will help you build more awareness about your mission and the work that you do, credibility, and it will also help foster trust amongst your various audiences and key stakeholders, namely your donors, funders, board members, and looking for opportunities to build that trust with existing audiences, but new audiences as well. So as you're looking to support new beneficiaries or get more people to join your team, or also looking for new funders and new strategic partners, or new opportunities that can lead to more funding or more exposure, or, you know, more impact. So next slide, please. So the first thing to consider whenever you're looking to begin doing media outreach is really to do your homework, right? And understand the media landscape, who's covering the type of stories or the type of organizations that are similar to yours. Really, so really taking some time to understand what are the media outlets in your respective communities, like what are the main players in terms of print, broadcast, by which I mean television or radio, and in the digital space, that can mean obviously news sites, but also blogs or podcasts, newsletters, etc. So there's just a plethora of outlets out there. So taking the time to just really appreciate what who, like, all these different avenues that you can explore, and then seeing how they cover the various stories that they put out. Like, is it more, are they more interested in data? Are they more interested in human interest stories? And how might you be able to plug into that? And similarly, when you're looking at the various outlets, really understanding, well, who are the reporters who are regularly covering the types of stories that you might be able to plug into, will be very important. So that just requires, there are tools that can help you uncover who those folks are. Certainly, if you have access to Muckrack or Cision, those are paid tools that will help expedite the process, because you can do some research by looking through keywords that relate to your mission, right? And then see who's covering those types of stories. Google obviously is a great tool to do that, but then, and I would highly recommend, if you're not familiar with Google Alerts, to just Google Alerts, and that is a great way to just stay on top of the stories that run on a daily basis with some the keywords that are of interest to you. And you could also set up a Google alert for your own respective organizations, leaders, etc. But the other thing to consider as well is, as you're doing research on these reporters, is to look them up on Twitter too, to see what are the themes the things that they're considering that they're interested in. They'll, in addition to maybe writing a story about these things, they may also be pondering about these things on Twitter. They might even be looking for people on Twitter to set up interviews on a specific topic. Sometimes they'll put out queries that way. Another way that they put out queries is help a reporter out. So that's a free tool that you can sign up for. You can just Google it. And basically what it will do is send out batches, like 3 batches a day of queries by a whole variety of reporters and outlets. So some of these are, you know, you're going to have to sift through a lot of stuff. A lot of it is not going to be relevant, but we've certainly have had some success at finding some good opportunities and matching those for our clients and getting some good coverage out of it. So with that said, it's important to do this and to do this type of exercise regularly because the media landscape changes a lot. There will be new media outlets that will pop up on a regular basis that might be of relevance to you. Reporters move around a lot. So it's just good to keep apprised on what's going on. So we can move on to the next slide. And the next thing that's really important is building relationships. So just like anything else, you know, reporters like us, they're human. So it's really important to just not treat outreach to reporters as transactional, but really ideally trying to really build those relationships in advance and positioning yourself as a resource to them. So if when you're approaching them and you're saying you're not looking for them to cover a specific story, it's more about like, well, here's who we are. We wanted to introduce ourselves, and here are the types of things that we've noticed you cover that we might be able to support you with, and sort of really kind of outlining that in a very succinct way. And we'll get into that in just a second. So it's important to just recognize that these reporters are so overwhelmed too. The newsrooms are constantly shedding reporters, sadly. So, you know, reporters are just saddled with a ton of work. For every reporter these days, there's about 10 PR people like myself. So you can just imagine in the broader population of folks who are approaching reporters with stories, there's an order of magnitude even beyond that. So just being brief and timely and doing your homework so that way you can really lead with your best foot forward and get their attention. That way will ensure that you are most successful. And then finally, you know, if they do decide to move forward and want to interview you or someone at your organization, like moving that forward and then after the fact being thankful just goes a long way. Again, going back to this idea of just being human and respectful and thoughtful. So, and the other last thing I will say is that when you're building relationships with these, oftentimes you're seeding you know, ideas for them to consider in the future. You may ideally want them to come right back to you and say, yes, I'd love to set something up tomorrow, but that may not necessarily happen. So just recognizing that, you know, it's okay if they don't come right back to you. They may come back to you later. And we've seen that time and again too, where we don't hear back at all. And then 3 months later, they're like, oh yes, I remember you had reached out about this. And now I'm doing a story about exactly what your organization is doing. So we'd love to set up a conversation. Next slide. So one of the critical ways that we're able to get in front of reporters is what we call a pitch, which is essentially a short email that the sole purpose is really to get their attention and help them see how this might be news that they can use. So there's a lot of like literature on this online, and I encourage you to take a look, but ultimately what you really want to think about is putting yourself in their shoes and understanding from their perspective how you might be able to elicit their interests by coming up with an angle that positions your organization as one that will be able to, you know, seem interesting and be able to ultimately be like ultimately serve as a source for them. So like trying to, if you have a timely hook or something like that, really explaining the why this is important and how this will resonate with their audience is going to be key. Another thing too is as you're doing your research, if you see a story that's relevant and might lead to another opportunity for them to do a follow-up story, you may want to reference as when you're starting off your email, reference that story or, you know, try to make that connection and sort of contextualize why this might be of interest to them based on what they've covered recently. Again, it's important to just be very, very succinct and get to the point. And the other thing I mentioned here is to not bury the lead. So oftentimes when we're sharing a story, we'll do so very sequentially in a very rational order, if you will. With the press, you oftentimes want to flip things around. So that way you're really bottom lining it for it, bottom lining the story that you're pitching them in one succinct sentence. So you're grabbing them from the word go, and then you can provide a little bit more detail after the fact. So, and then if you can provide, again, what I was talking about, news that that they can use, like videos, images, statistics, infographics, like these are all things that are crunchy that reporters, it makes their job easier. They can repurpose that, repackage it, and share it with their respective audiences. So oftentimes they'll really appreciate that. And then this is a case where maybe I also buried the lead a little bit. Having a strong subject line will really make or break your opportunity to get through and have them open your email. So I think we can move to the next slide. And one thing I also mentioned here is taking into account lead time. So by that, I mean, if you're dealing with a daily newspaper, they're probably going to be able to turn a story around pretty quickly. They're built, they have that capacity to do that. But if you're reaching out to a glossy magazine that only you know, publishes once a month or something like that, you'll probably want to reach out well before then. And it's good to take a look at media, like those websites, those media outlets' respective media kits, because they'll have some information in those that show like when their ad deadlines close, and you'll be able to get a sense of how long in advance you'll want to reach out to share your story. So with that said, now you've landed an interview. There's a couple things to keep in mind when you are having the interview. So just first and foremost, you really just want to tell a very clear story. You want to keep your key points very succinct. So 3 to 5 things max. Oh, sorry. I realize we're a couple minutes over time, Petra. Do we still have time to go, or should we?
If you can just finish up quickly. And I'm sorry about the, I just wanted to get my email off. I don't know how that got up there.
Oh, no worries. I think we're almost done, actually.
There you go again.
So yeah, these are just some tips to make sure that you are getting your message across efficiently in a way that will resonate with the reporter. So like just making sure that you are leading with those 3 to 5 key messages and making sure that you're very clear on what those are, articulating why this is, again, compelling, and what really distinguishes you from other potential sources, making sure that you're keeping their audience in mind so that you're using language that they're going to be able to understand. So avoiding jargon, keep it short and simple, using, again, this is important too. If there's something you don't know, if they're asking a question that you're not aware, don't make things up. Just be very upfront. Share what you do know, stick with facts. And if there's a question you can't immediately answer, in most circumstances, unless you're like, it's a live television interview, you'll be able to go back to the reporter and say, look, I'll come back to you with this. Let me research, check with the team, and we'll be able to share some information, so that you're always, you know, operating from a fact-based stance, if you will. And I think there's just one more slide, if I'm not mistaken. Yeah. So these are just some quick points, and I'll leave you with this, on how to control and stay on message. And there are so many different kinds of interviewers, different styles. So I think you just have to understand that they may have their agenda, but you have yours. So even if they ask some questions that don't exactly touch upon the core messages that you want to get across, you have to take your opportunity. So if they ask you a question, always address their question, but then take an opportunity to pivot and go to your core messages as well. So and there are lots of tools, and again, I encourage you to go online to look into this a little bit on how you can do that efficiently. But pivoting is sort of like the mantra whenever we give these media trainings. It's just very important to do that. And in advance, if you can practice doing that before the interview, I think it will be time very well spent. So just something to consider. The other thing too is keeping your questions or your responses to questions very brief. 1 or 2 minutes usually does it. And again, being concise and trying to really have control over what you're saying. So the way to sort of gauge that, as you can see here, is to try to cover something in about 10 seconds. That will give you a sense of control. You'll be able to get through what you need to say. If you're trying to cover too many things in a short time period, you're just not going to be as efficient and as clear as you would like. So that's very important. Also having some very vivid examples to share to illustrate your point. And the other thing too that lends credibility is being able to quote unquote name drop when it makes sense. So sharing like-minded organizations or donors or examples that will help just build credibility for your own organization. So I think that's all I've got. And like I said, I know we were trying to pack a whole bunch in 30 minutes. So since we're a little bit over time, I'll turn it back over to you, Petra. And if anyone has questions, by all means, you can feel free to follow up with me. Thank you so much.
Thank you so much, Isabel and Grace. We really appreciate you guys taking time out to do this for us. It's really helpful to be able to look at things from a different way. We're all learning so much about how to communicate and how to most effectively communicate. So thank you so much. And we will actually share the slide deck with this group with your email. So thank you for offering in advance to answer people's questions. We don't have a lot of time, so I don't think we're going to be able to take questions. I'm sorry about that. But we will let people email you with questions or email us and we can forward them on either way.
Yes, please send us any questions. Yeah, thank you all. It's nice to see you.
Thank you. We really appreciate it. And we're going to go to our breakout rooms because I know that we didn't have a lot of time to go into that. So we're going to have 20 minutes in each breakout room, and we're going to talk about successes and challenges. And then we're going to come out and kind of report back to the whole group. So you should be invited to a group right now. And if you're not invited, then Kirsten will help you in the end.
For the vaccine, people really are wanting the vaccine. So that hasn't been too much of a hurdle. But the biggest challenge, it seems to be, I think like younger people feel like they aren't going to get vaccinated for a really long time. And, the sites are always booked when people try to go online, or the numbers they call are busy. So that has still been a challenge within the community. But I think the success I heard a lot is that people are really anxious and excited about the vaccine, and that there's been a lot of good dialogue going on around it. So.
Thank you. Helen, are you the spokesperson for your group or somebody else?
Yeah, I can go next. So we were the Chinese Filipino breakout group, and we had Benny from Healthways, Pearl from NIMS, Felix from Self Help for the Elderly, and Rebecca in our group. Thank you all for participating. So it seems like in terms of successes, people are more interested in getting the vaccine. They're a little more motivated now. So that's been great. The younger population also came up as a challenge in ours, engaging them, and younger generations feel that also they're outside more and maybe are more exposed. And so sometimes they feel a little left out. And then I think something that came up for us as a huge challenge is, lots of conflicting information pouring into the community. So social media has been this great way to disseminate information, but it can also disseminate misinformation. And I think Felix pointed out that, for the Chinese community, WeChat is very prevalent, but Chinese communities also listen to Chinese media as well. And those might have differing messages on vaccine types and things like that. So something to keep in mind for that community specifically.
We missed WeChat when we did our social media poll. We have, Georgia, are you speaking for your group?
We nominated Keisha.
Excellent.
Hi, so we're from the Pacific Islander breakout room, and some of the difficulties that we discussed was basically finding content or posts, like getting a call to action, as well as time constraints, creating content desired for all outlets, and keeping up with engagement. And some of the successes that we found were using key figures in the community is a great tool in creating engagement and views. One success that we used is we had a talking counselor speak as a resource for the Bay Area Health Council, and that had a lot of clicks and views among our communities, the PI communities. And also another success that we discussed was using tools like calendars, and the Hootsuite is a good way to be able to utilize these tools to make our content more effective and efficient.
Thank you. Were those all of the groups?
We have not also yet. Okay, so I was with the adult group, and there's a lot of success on getting vaccination information out with either goodie bags or Meals on Wheels, and also at the farmers market. Also, a lot of people got already vaccinated, yet the challenges are reaching out to Chinese speaking communities, limited English proficiency communities. Some seniors have some issues with technical issues to know about the vaccination information, vaccination sites. Also, one of the challenge that was mentioned is about seniors who are staying in home and can't go out to get vaccinated. So those are mainly the challenges. There's one suggestion is to have a dedicated conversation to all of us share about best practices and solutions, not only mentioning success and challenges. So hopefully we are setting this soon.
Thank you, Sarah, and welcome back. So it is exactly 2:30. Does anybody have anything quick they want to add before we wrap up? I don't see anyone, but I don't see anyone anyway. So I want to thank you guys all. This was a super condensed meeting. We had a lot to do, but we got a lot done, and we will be sending out follow-ups on all of this like we always do, with notes, some of the best practices. We will also send out the slide deck from the media experts, and I hope that you found that all useful. And we really appreciate that you're all here and that you're doing this really important work, and whatever we can do to support you to be effective, we are happy to do. So reach out anytime, and thanks for coming, and see y'all in a month. And probably sooner.